Good evening, everyone, and a very warm welcome to this special Women's Day gathering of Sampurnam's Inner Healing Collective. For many of us here, this circle has already been a meaningful journey. Over the past 10 weeks, we have come together week after week to explore healing as a deeper process of reconnecting with ourselves. Today feels particularly special because after completing the first 10 cycles, we meet again, this time for Women's Day session that honors the wisdom, rhythms, and inner intelligence of the feminine body. The Inner Healing Collective will continue to meet once every month, so stay with us through this journey. For those who may be joining us for the first time today through this Women's Day session, a brief introduction. Sampurnam is a holistic clinic based in Horse Cars, Delhi. Our work is rooted in creating a thoughtful balance between modern evidence based medicine and the profound insights of ancient healing wisdom. Today's session is titled Surrendering to the Natural Menstrual and Lunar Cycles for Health and Harmony in Life. And we have with us Dr. Parul Chopra Buttan. Dr. Buttan has worked as an obstetrician and gynecologist for nearly 2 decades. Her training at institutions such as Sir Gangaram Hospital and the Royal College of Obstetricians and Gynecologists gave her a strong foundation in the science and practice of allopathic medicine and surgery, which she has served with deep commitment. Moved by the suffering of women she witnessed both professionally and personally, she developed a deep longing to understand disease and healing in totality. This quest took her within herself, where she discovered the universe in the microcosm of an individual human being. So she brings today not only medical expertise, but also a deeply reflective understanding of life. So, with that, I warmly invite Dr. Parul Chopra Buttan to lead us into today's exploration of the wisdom of menstrual and lunar cycles and how reconnecting with these natural rhythms can support greater health, harmony, and self understanding in the lives of women.
Is the silence and speech. The tides rise and fall. We sleep and then we awake. We inhale and then we exhale. There is the water cycle in nature, where water changes state from ice to water and then vapor. The sun rises, the sun sets. Now, one important point to note before we move on is that the sun doesn't really rise up in the sky or set. It is the rotation of the Earth on its axis that produces the perception of sunrise and the sunset when viewed from the Earth's perspective, making the experience of day and night quite real for us. In absolute reality, there is no day and night, the sun just is. However, at an experiential level, life is dualistic. And this has great value. So, this is what we will explore today in this talk, the natural cycles that we perceive and that are very dear to me, that actually govern and guide the lives of women and consequently of families, of the whole society. So, we're talking about the menstrual cycles today. The menstrual cycle is not merely a biological function for reproduction, but your cycles are actually a very accurate and a very wise mirror to your health. And your health is a very accurate and wise mirror to the harmony in your life. The body does not lie. I speak this as a statement of fact. It has also been a very deep truth that I have experienced. Your health is not disconnected from your relationships, from your circumstances, from how powerful or powerless the sense of agency you feel in life. And the more you understand yourself, the less you fight the flow, and the more expertly you're able to surf the waves of life. So today we'll be looking at the cycles from two perspectives: the Western clinical medicine's endocrinology, and which shows the intricate dance of hormones inside the women's bodies, and then the Eastern wisdom, of which views the cycles as a reflection of the lunar rhythm and the flow of vital energy. So here, there are a few participants entering. Dr. Mangal, will someone be able to admit them, or do I need to do that?
I will be doing it, Dr. Parul.
Okay. So here on the screen, you can see on the left side, there is a wheel numbered from 1 to 28. And there are 4 color codes in it. There is 1 to 5 is coded in red, 6 to 14 is yellow, and then we have pink and then blue. So when we talk about the menstrual cycles, day 1 is the day a woman's period begins. The first phase that is here in red, days 1 to 5, this is the menstrual phase. It typically lasts from 3 to 7 days, guided by a signal from a gland in the brain, from the hypothalamus, which is the great master gland in the brain. The master gland, which responds to signals from the hypothalamus, that is the pituitary, it releases a hormone called FSH. So for the first phase, the menstrual phase, the key hormone is FSH, also called as follicle stimulating hormone. This works upon the ovaries, and the ovaries then begin to recruit a few potential eggs to grow. At this time, the uterus is in the shedding phase. So the old soil is being cleared out so that the ground is refreshed, and the woman experiences the menstrual bleed for a couple of days. With this phase ending, the second phase begins, which is colored in yellow here from days 6 to 14. And all these phases merge into each other. So they do not have watertight boundaries, but one phase flows into the other. So the second phase, we title it as the follicular phase. This typically lasts about 10 to 14 days. And the hormone levels, which had begun to rise in the first phase, grow further. Now, the ovaries release a hormone called estrogen. So the hormone for the second phase is the estrogen. This helps potential eggs to grow further. The uterine lining, which had shed in the first phase, now begins to thicken. So this is like fresh soil is being laid, anticipating the arrival of the guest, which is a potential pregnancy. Once the estrogen has risen to a peak, the third phase begins, which is labeled here between days 15 to 19 in the pink color. This is ovulation, and this typically lasts 2 to 4 days. As the estrogen hits a peak, a surge of LH, which is luteinizing hormone, occurs from the brain, the master pituitary, and this triggers the release of one egg. For the woman, this is the peak fertility time. And post this, the fourth phase or the luteal phase begins, which typically lasts from 10 to 14 days, and the hormonal milieu changes. So from the first phase being FSH dominant, the second phase being estrogen dominant, the third phase again being LH dominant from the brain. This fourth phase, the ovaries now secrete a hormone called progesterone. And this governs this phase of the cycle. Its job is to ripen the uterine lining, making it spongy and secure, conducive for implantation and nurturing the early pregnancy if it has occurred. This is quite typically like loosening up the soil so that the seed can get its nourishment from the soil. So if a pregnancy has not occurred, the hormone levels fall, and then the next cycle begins with bleeding again. This is typically about 28 to 32, 35 days, anywhere around this phase, around this time in a woman's body. The other way that we can understand this cycle is through the Eastern wisdom, which is through the cycle of the moon. Now, both Ayurveda and traditional Chinese medicine, they have long linked the female cycle to the moon. A lunar month is typically 29 and a half days, in which, and women who are living aligned with nature, their cycles very often mirror the phases of the moon pretty exactly. The cycle is seen as a movement between yin and yang. Yin is the cool, receptive, internal energy. Yang is the warm, active, external, masculine principle. Now, the cycle starts here on the Amavasya, which is the new moon. So, for many women, especially ones who live according to the circadian rhythm and live aligned with nature, menstruation happens around or begins on the Amavasya. So, the menstruation phase coincides with the new moon phase. In traditional Chinese medicine, this is called the great release, where blood moves downwards. This is the typical, the peak yin time, and it coincides with introspection and rest. Now, the waxing moon phase, which we understand as the Shukla Paksh of a month, is the follicular phase or the second phase. Here, energy begins to rise. Just as the moon is growing in the sky, the lining is thickening in the uterus, the egg is growing in the ovary. So, almost fantastically, it mirrors what's happening in the sky. The transition happens from yin to yang. So, this is characterized by building of the blood and the chi, which is the life energy. Following this happens the full moon, which is the Purnima. And ovulation very often in women coincides with the Purnima. This is the peak of yang energy. Much like the full moon illuminates the night sky, ovulation represents maximum outward expression, heat, and magnetism. And following the full moon is the waxing moon phase, the decreasing moon. This is the Krishna Paksh of our Hindi calendar. And the luteal phase or the premenstrual phase coincides with this time. Now, as the moon fades in the night sky, the energy also starts to turn inwards. This is a very, very powerful time in the life of a woman. And this is when the veil between the conscious and the subconscious mind is at its thinnest. It leads to very heightened intuition and various other emotional offshoots that spring from it. So, we understand the hormones and now we understand the phases of the moon, which typically coincide with our cycles and with our moods. How do we achieve a harmony, or how do we practically understand and apply this principle in life? So, health and harmony is achieved when we stop resisting this and serve them intelligently by living in sync. In Western medicine, they're also using a term nowadays called cycle syncing. How can you sync your cycle with nature? And this is best understood by the metaphor of seasons. So the menstruation, the first phase can be likened to the inner winter. The follicular phase can be likened to the inner spring. Ovulation is your peak summertime. And luteal phase or the premenstrual phase is the autumn phase. I will be discussing these in detail. And we start with the menstruation, which is the inner winter. Now, winter, if you think of winter, it is typically the time to stay indoors. It is the time to support the body through gentle movement, deep nourishment. And practically, one notices, especially in other mammals, they will hibernate. So appetite will go down and restfulness will increase. This also is seen in a lot of women where appetite typically falls at this time. You may experience nausea, pelvic cramps, a desire to rest. In terms of diet, we recommend prioritizing iron-rich foods, best if coupled with vitamin C, plenty of fluids so as to replenish the loss which is happening in bleeding. In terms of exercise, low intensity, gentle exercise such as walking or yoga or Pilates would be best suited to this phase. As per Ayurveda, this is the time for Panavayu, which is downward flow. So certain asanas like the inversions, such as headstands, handstands, should be avoided at this time. And we typically sit around a fire or we sit with a heating pad in winters. That is exactly what this phase asks of us, using heating pads or moist heat to relax the uterine muscles and reduce the cramping. The way we can allow this phase to be to move through us is to allow the flow and emotionally release. So don't hold back. Women very often who have a tendency to hold on to past hurts, not letting go of past baggages, very often experience poor, irregular, or a staccato flow. Flow will start and then stop, and 2 days later, again, it'll start. There'll be bursts, there'll be dark colored brown discharge, but proper, healthy flow, red, bright, will not occur. Another thing that has been noted by some masters is women who don't shed tears, who are very strong, iron willed, having a very strong exterior, sometimes bleed excessively. And I often happen to comment if you don't shed your tears through your eyes, your uterus sheds them through the bleeding. So maybe it would be wise to explore if there's some hidden anger, if you have an experience of joy running out of your life. You might experience this as a very heavy flow or as the flow starting and then just not stopping. So multiple menstrual disturbances that are noted at this time, maybe a prolonged flow or a scanty flow or a very painful flow, they often arise from a rejection of one's femininity due to guilt, fear, shame, and multiple diseases that we see at this time. This is very often why women consult a gynecologist, because this is the phase that shows up. While it is a result of whatever happened in the last cycle and whatever happened in the last three phases, it is a beautiful dance between the brain and the uterus and the ovaries. But it is the menstruation which shows up as a physical sign that women can then detect a normalcy or an abnormality with. Now, all diseases can be categorized into three levels of disease, I would call it. There are acute diseases. Acute diseases are diseases which are of short duration, such as cold, flu, heavy bleeding, also called as menorrhagia or anemia. This is your body whispering, your body communicating, your body giving you some feedback. The next level of disease, if you don't really listen to your body, is the chronic diseases. Chronic diseases are such as arthritis, diabetes, hypertension. In the women's menstrual cycle, they could be fibroids, adenomyosis, endometriosis. And if you still do not decode the message that the body is giving you, do not pay attention, or somehow are unable to follow the wisdom that is being shared, then the third level of disease is the destructive disease. Destructive diseases are diseases like cancer, diseases like organ failure, liver cirrhosis, kidney failure. These are destructive diseases. The body now has put you on a timer, and the body is now giving you a very clear signal. Either you follow its wisdom, if you listen to what it's screaming about, or perhaps think about leaving this body and discarding this one, getting a new one, and maybe starting all over again. So, typically, in terms of menstrual cycle, the acute diseases are heavy bleeding, irregular bleeding. The chronic diseases are structural issues that we see: adenomyosis, endometriosis, fibroids, which are growth in the uterus. And destructive is uterine cancer, ovarian cancer. In gynecology, a part of the overlap that happens with surgery is also the breast cancer. So, very typically, a woman is considered impure at this stage. औरत मैली है, उसको छूना नहीं है इस time पे. Our Eastern older traditions and rituals used to say she is to be left alone. She is to step out of the kitchen. She's not to step into the main area of the house. She's to sit alone. She's to meditate. She is to be quiet. Nobody talks to her. Nobody touches her. The way I understand, and I understood it through my practice was a woman is not impure at this phase. In fact, a woman is purifying. So वो औरत मैली नहीं है, औरत हर महीने साफ हो रही है. Unfortunately, the man does not get this cleansing ritual, the advantage of this cleansing ritual cyclically. So, very important to respect the bleed in a world that demands 24/7 productivity. And when I say this, I'm very cautious about using the word world. When I say the world is demanding 24/7 productivity, who is it that's really demanding this productivity of me? It is not a world separate from me, a world that exists independent of me, but it is my own internalized expectations and fears and belief systems and identities that reflect outside. So my world begins to demand productivity from me because it is reflecting to me my belief systems, my identities, my programs that got installed earlier, and perhaps I never had the chance to re examine them. So, truly, if your world is demanding that 24/7 productivity from you, look within. The button to change the world is inside you. So, this period of menstruation is a mandatory sabbatical for women. Radical rest during this time prevents burnout and also reduces the PMS symptoms or the luteal phase discomfort, the rage, the sadness later on. So, after winter comes what we're currently experiencing outside in North India, the inner spring, the follicular phase. What's happening here is energy is building, your creativity is rising. So as the estrogen hormone is rising within you, you can support it by a good diet, by incorporating a lot of lean proteins, by incorporating complex carbohydrates, fermented foods to support your gut health. In terms of exercise, this is the time to ramp up. You can do high intensity interval training, you can go hiking, cardio, strength training. So this is the time to put this energy to good use and ramp up your exercise routine. This is the best time for social engagement. It's a good time to start new projects. Your enthusiasm is rising. You're very focused, you're very calm. Your brain is most plastic and ready to learn new things. Just as nature around you is growing new flowers and new leaves, so is your body. So excellent time to plan new things, to start new projects. Following this is our third phase, the ovulation, and this is the inner summer. Summer is when you feel hot, and your body directly mirrors this. At the time of ovulation, you'll notice the basal body temperature rises. Women start to feel very hot. If they are looking at fertility and they're measuring their temperatures daily, they will notice a half degree or a 1 degree rise of temperature, 0.5 to 1 degree rise in Fahrenheit. This is peak performance time. Your time to shine like the Chaudhvi ka chand in the sky. Your outward expression is strong, it is robust, you're magnetic. You can schedule presentations at this time, schedule your difficult conversations at this time. You can go on dates. You're charming at this time. If you're looking for a partner, this is the time to explore. You're biologically wired to be more communicative and confident at this time. So, in terms of your diet, it would be nice to support the liver. The liver is processing, in this phase, the liver is processing the estrogen from the previous phase of the cycle. So, including a lot of cruciferous vegetables, fresh fruits, seasonal fruits in your diet helps the liver. Cutting out alcohol, needless to say, I would recommend not consuming alcohol in any phase of the cycle, irrespective of social engagements. Maybe we can normalize a clean and active and a healthy lifestyle by not even considering alcohol for the purpose of this presentation today. In terms of exercise, your stamina is the highest. And use it for kickboxing, use it for high intensity interval training, use it for heavy lifting. Strength training is super valuable at this time. And if this energy is not put to good use through robust exercise, very often emotionally, what women experience is ovulatory anxiety that shows up in the body as restlessness. So, libido also rises at this time. You will notice higher desire for sexual intercourse. If you're looking to conceive, this is peak fertility time, and your body is guiding you accordingly. The physical changes in the body also support conception. So the vaginal mucus becomes thin, the cervix, the mouth of the uterus opens, the egg is getting released, and the whole body is conspiring to allow the sperm to meet the egg. Following this, the summer comes our most difficult season internally. This is the inner autumn, the luteal phase, commonly known as the premenstrual phase. It is, and thanks to social media and internet, PMS has become quite a widespread term today. In fact, it is a verb. I'm PMSing. Or in office, you'd hear a men talking about a woman bossing. You know, she must be PMSing at this time. Uh, looks crazy, looks cagey. So typically, this is a time for stabilization. It is a time for turning inwards. The yang energy is now moving to yin energy, which is receptive, which is internal. In terms of diet, very often women notice that cravings show up. Um, we don't eat only to nourish the body, unfortunately, in modern society. We eat for socializing, we eat to reduce stress, we eat to achieve comfort. Not the best way, not the most sattvic way to consume food. And so, very important to be mindful of how the body is showing up. And if cravings arise, instead of giving into the cravings, this is an opportunity to assess where the craving is arising from. And perhaps every time I have a craving, let's say for chocolate, I could either indulge the craving by taking a bar of chocolate. I could also release the craving. And every time I gently do not honor the craving, I do not consume a bar of chocolate, I am giving the body an opportunity to release this dependence. So, including magnesium supplements at this time really helps. Including high fiber foods is very, very helpful at this time because the hormone progesterone, which governs this phase, reduces the gut motility, and constipation may show up in women who are prone to it. It is also wise to reduce salt intake at this time since the body typically is bloated, there's water retention. Minimizing caffeine, in fact, I would suggest cutting out caffeine altogether, again, is very powerful at this time. Already, you will notice a certain jitteriness in your chest area, maybe your heartbeat fluctuates, and adding caffeine makes the body very uncomfortable and it pushes the body on the edge. In terms of exercise, this is a shift to moderate intensity strength training or cardio. So gradually, as you reducing the intensity, you will gradually move towards gentle stretching or yoga or just walk as your period approaches. So I remember when I was in the last decade actively working out in the gym, the way you know that a gym trainer is good is he has no previously fixed plan of exercise, but he decides on the plan of exercise as he sees you walking into the gym. And I would actually wonder, how does he know that today is the time to push, and how does he know that today he'll go very easy on me. He'll say, "Aaj aap sirf ye kar lijiye." And I asked him once, and he says, "I know it because when I see you walking into the gym, that is when I just with one look I clock it." So there was very rare instances when I needed to tell him that I'm unable to put up with what he's the ringer that he's putting me through. So your body communicates not just internally to yourself, but it also communicates externally to a person who's attuned to you. And a, a good professional, be it a good doctor or a good masseuse or a good gym trainer, a good anybody that you're relating to, a good husband, a good son, They would be very attuned to the way your body is behaving because your body communicates loud and clear this time. In terms of the social lifestyle of this phase is a phase for focusing on nesting. Very often women, by the way, the gynecological consultations peak at this time. And very often, for the women who are aligned to the cycle, they find it very uncomfortable. And I find it very curious because in this Krishna Paksh, I would be having the premenstrual symptoms inside, and my world outside, my patients outside would be mirroring the same. Doctor, I just don't feel like meeting anyone. I want to stay home, but I am a lawyer. I am a corporate CEO, but I am. And therefore, there is this conflict that women approach gynecologists with, that the inner body is communicating something very different from what the outer demands are being placed. And my usual answer to them is, if you want to stay home, please stay home. Stay home, declutter, clean, restore. This is the time to finish up the tasks which were started in the follicular phase. It is a time to allow rest, allow recovery. And one of my favorite guidances for this phase is, this is the time that your bullshit meter is at its most sensitive. So be very careful about what is it that is irritating you at this time. Um, True spiritual path, or the true way to live life, is also about sacred removal of what is not real. Spirituality is not being polite. Spirituality is not talking very softly. Spirituality is not wearing beads or malas, or spirituality is not about talking about esoteric concepts and reading up many books and many scriptures. But true spirituality is about honoring how life wants to flow through you, uniquely through you. So, all the masks, the stories, the identities which you've outgrown, the traumas, this is the time to dissolve all of them by aligning to what is showing up for you. So, if there's someone that you don't want to meet, please don't meet them. Or if you do meet them, notice how explosive the meeting went. Uh, if a woman is in an abusive marriage, no matter what she does in the other areas of life, in this phase, she's going to have massive fights. The marriage will show up particularly as explosive until she receives the message that perhaps it's time to walk out of the marriage, or for one of them to radically change, which will require the other one to radically change as well. If I have an abusive relationship, let's say with my parents or with my boss at work, this phase will guide me to maintain distance. I will get very triggered. There'll be lots of irritability. So, this is a very, very powerful phase. And as we allow our masks and stories and outgrown identities and traumas to dissolve, what then remains is pure, unfiltered presence. And how do you know? How do you know that you're listening and you're aligning? You're living an aligned and attuned life. You know it by your period cycles. Your periods are less painful. The flow starts and stops at a specific time. It is bright red in color. It is not endless. It is not draining. You can physically feel the shift of seasons in your body temperature, your moods, your social inclinations. Everything's very clear to you only if you were to listen. This phase, the premenstrual phase, is when the Shakti comes and resides in her home. So I'm not talking about just the four walls of the house, while that is a wonderful time, and I hope it's a wonderful crucible for you to rest as well. This is the time when you go inwards and you rest within yourself. Your silence here holds space for everyone and everything. This is not merely silence of words or external speech, but this is an inner quietude. You may be silent in words, or you may be actively speaking a lot, but the words that you will be speaking will evoke silence and shanti and peace and solace and joy in the other, because these words will arise from the inner quietude, from alignment. And this is where I believe our scriptures or our Vedic, wherever this term comes from, घर की लक्ष्मी. जब घर की लक्ष्मी का घर के अंदर वास होता है, there is only prosperity and abundance around. And unfortunately, in the name of feminism, women have become so masculinized that so many women believe unless they are out foraging and hunting and contributing, doing the typically masculine tasks, they're not contributing. Whereas Shakti's great power, the great power of the woman, was to hold space at home while the man went out to hunt and forage. It was his job to take the risks. It was his job to physically, he was physically more uh, balanced to go out and hunt and take those risks and forage, because he would just need to plant the seed. The masculine energy plants the seed and then goes out to bring nourishment home. And it is the feminine energy which receives, which nurtures, which nourishes. Staying at home, the woman can be so powerful. A woman who is aligned can be infinitely more powerful. She's actually powerful wherever she is. Uh, the more aligned she gets, uh, it's almost like some divine power and energy starts to flow through her. She's very intuitive. She can read what's coming. She can guide the husband, the children, the colleagues, the juniors, her clients. Uh, It is so beautiful, and it is equally disruptive if you fight it. So many women in my practice, and this has also been a personal experience in this body. The periods were very disruptive in their 20s when women are trying to conceive. And when alignment strikes, when midlife finally screams at them and they start to awaken, they start to align. So many women have better period cycles in their 40s, even going on into their 50s. So your body will give you feedback if we have the courage and the softness and the readiness to hear it. So this is a summary. I am not an expert on breath work. However, breath work is something that I have used in my own journey to ease certain things in the body. Journaling helps us because our thoughts rush at a speed of 1,000,000 miles an hour. When we start to speak out those thoughts, they slow. But when I start to write, I can't write as fast as I can speak, and I can't speak as fast as I can think. So, journaling is a wonderful way to slow down the thoughts. I often say, even during a Formula One race, the Ferrari needs to stop for the tires to be changed. There is a pit stop. You cannot change the tires on a Ferrari when it's going at 400 kilometers per hour. And that is exactly what we need. We need to slow down in life so that we can really see what's happening and align life accordingly. And if you were to delete the whole presentation and everything I've said, perhaps the first word and the last two words are the only things. The first word was surrender, and the last words are know yourself. I invite you to recognize the wisdom and the guidance of nature. Anyways, there is no escape from yourself. So, living in accordance with how your body is guiding you, rather than imposing your will upon it, means there's no preference for any one phase, because a preference for any one phase creates disharmony. If the birth of the body is auspicious but death is not, if the beginning of a relationship is celebrated but the completion is not, if I love to inhale but I do not want to exhale, then I'm not in alignment. I'm creating violence, violence for myself, and it is the same violence and the same pollution that we see outside in the world. The only violence is not being in alignment with what is. And this is the only disease or suffering that we're ever suffering, be it problems of relationships, be it problems of the body. All suffering arises from being out of tune with what is. I have recently noticed this body's begun to sing like crazy. I had never uttered a word in song. And I heard a beautiful music teacher say, Sur is the only liberation. And I understand Sur more than just the Vakshuddhi, which is infinitely powerful by itself. But being in Sur means living in integrity. Mansa vacha karmana. आपके मन में जो है, आपके शब्दों में जो है और आपके कर्मों में जो है, when all of that is aligned, when all of that is in integrity, um, you are in grace. You are receiving of all the grace that is flowing infinitely around you, within you. So this heals not just you, but it heals your family. It heals generations before and generations after. In fact, I'd say world peace begins here. So I once heard a 40-year-old woman say, PMS was killing me and cancer saved my life. Her only complaint prior to massive diagnosis was PMS. The body would shout, irritability would be at the peak, but she was holding on too tight. And then she received, again in grace, she received a diagnosis which helped her release whatever needed to be released. And every other disease in the body, in the relationships, in the external world healed as well. So the only cycle that life consists of is rest and play. So a life lived like this, where you're either resting or playing, all work is play, all interaction is play. A life lived like this is fulfilling, it's deeply nourishing. And all that is needed is surrender to the divine and allowing that infinite intelligence to guide you through the body. So thank you very much. And perhaps we could see if I can stop sharing my screen now.
Thank you, Dr. Parul. This was really beautiful. And
Thank you. I would invite, if it's okay with everyone, if we could go into a minute of silence, just allow whatever's been spoken here. Let's have the cycle of silence after the cycle of speech. I have my Pomodoro alarm clock here. If it's okay with everyone, I'd like to invite everyone for silence for 3 minutes. The only meditation that I've personally done and that I recommend wholeheartedly is the Vipassana. So there will be no music played, and I would recommend we just close our eyes. We can sit with our spines straight. Um, I am sitting on the floor, so it's easy for me to cross my legs. If it's possible, please cross your legs. If you're sitting on a chair, you could cross your legs sitting up. The hands, if we can interlace the fingers like this and place them gently on in our lap, whether we're sitting or we're sitting on the floor. And so I'm setting the alarm to 3 minutes, and we close our eyes and we just allow whatever comes up for us with silence of speech and the closure of the eyes, so silence of the vision. I am starting now. Please rub your hands together and place them gently on your closed eyelids. And whenever you feel ready, take a deep breath and you may open your eyes. I think we can open up for anybody who wants to make a comment or has any question to ask. Please feel free to share.
You can put your questions on the chat, or you can unmute yourself and ask the question.
Um, Hi, hello. Thank you for a beautiful session, Parul ma'am. It was really great listening to you. You literally shared so much knowledge, and I think I'll have to re-go through the recording to understand and just to absorb everything in a better way. So thank you for that. I just have a question which probably would be maybe right on this platform. So um, I have seen that during my cycles, monthly cycles, my flow sometimes is very less. Like the period flow is really less. And is there a pattern that we can draw? Is there something that we can say that this might be the reason for that? Or is it due to stress? Or is it of concern? Is it of if it is something that we need to monitor over the months, and if it is just happening once in a while, then we can just let it go and just not think much on it. If you can just provide some guidance over that, that would be really great.
Sure. Uh, so thank you, Manmeet. Regarding the flow, if one odd cycle you notice that the flow was too scanty, it would be wise to just go through what was really happening in this month. And if there was a particular event that you noticed, for example, if you noticed there was international travel or sleep was particularly disrupted, and this is a one off event, it happened once, and then you can wait and watch for another cycle. It normalizes after that, then perhaps you can let it go. It is just giving you information about why the flow could be disrupted, or if you had a viral infection, or there was a particularly stressful social event that you were attending. The other, when you notice that this is a pattern that maybe happened once and then you notice it more than 3 cycles in a year, or it happened once and then it's continuing for 3 months or 4 months or 6 months. 3 months is usually a good time to consult a gynecologist. We typically take your history and get some tests done, hormone measurements. Two most common reasons for this could be thyroid imbalances and PCOS, especially in young women of reproductive age group. So we test for thyroid imbalance, and that lets us know if you have a family history of thyroid imbalance or you have a personal history and medication was stopped. Typically, it would show up as scanty flow in periods, even irregular or delayed periods. The other one, it's almost become the national disease of women in this decade or the last decade combined, PCOS, which is polycystic ovarian syndrome. Again, we measure certain hormones, like I mentioned, the FSH, the LH. So typically, when we measure these hormones on the second or the third day of the cycle, which is when they've just begun to rise, the ratio is usually 1:1. So 1:1 is a healthy ratio. And for young women, the level of a healthy level of FSH would be less than 10. So if your FSH is 7 and the luteinizing hormone or LH is around 6, 7, 8, that's good enough. PCOS, what happens is that the LH rises exponentially. So the LH may become twice or even 3 times as compared to the FSH. So that guides us. There are certain criteria that we follow. There are ultrasounds that we get done. There are blood tests that we get done based on your history. Is there any facial hair growth? Is there any weight that you've gained, particularly on the midsection of your body? Any acne? Very often, acne can be one of the accompanying or even the presenting the primary symptom for such women. Energetically, if you understand what is happening, PCOS again is a rejection of the femininity. Acne happens more when your testosterone rises, it happens more in men. Likewise, facial hair is a mark of men, it's a mark of masculinity. So women are growing beards and women are literally growing mustaches and women are stopping menstruation because women are becoming so masculine. So maybe from a self-assessment or an energetic point of view, see if you are being pulled very strongly towards outward action, and maybe the feminine, the receptive, the quiet, the irreceptive internal cool principle in you is getting less attention. Whichever body we present in, for example, whether it's the body of a woman or the body of a man, we have both masculine and feminine energies within us. That is, I think, where the Ardhanarishwar guidance also comes from. So when we're relating with people, very often our relatability comes from. So, for example, right now in the last half an hour, uh, the talking that I was doing, it was coming from a masculine. So this was outward action. This is me putting forth my ideas. But over the last week or so, when I was preparing this presentation, there was quietude, and that was the feminine principle which was acting. So when we typically meet with someone, so if you notice your colleagues, everybody is very dependent on you, and you're the one who's the go-getter in the office, and you're the one who's doing all the outward action. Perhaps then masculine energy So it's not a fault, it's neither a feature nor a bug. It is something that we can utilize. That, if in the office you see that your co-workers are slacking and you're needing to pick up the slack, you're needing to go and achieve more work for the company, get tasks done, then perhaps the masculine energy is running in overdrive. And if you can titrate that a little bit, it'll give you feedback in terms of your period cycles. It'll also help the people around you pick up slack. So it's always a win-win. What is not good for you is not good for the people around you as well. So there is never a conflict. If we are like I said in the first beginning itself, if we are noticing duality, if you're noticing conflict, go one dimension higher and you'll see it is all one. For example, if I see a plant and an animal, I would see them as two. But as soon as I go to the kingdom of living beings, they become one. You see a man and a woman, as soon as you go to the level of species, it becomes one. It's a human being. As soon as we see the living world and the non-living world, as soon as we go a dimension higher, it becomes the manifest world, the Prakriti. Living, non-living together becomes the Prakriti. So the masculine and the feminine, understanding this helps you titrate the play and helps you play more effectively. Uh, does that help?
Yeah, I do have a cross question if everybody is okay with it. I really feel I need to have this conversation. Maybe I can meet you sometime and we can have a detailed conversation on the feminist and the masculine energy and, what all we are going through in life. Sometimes there are situations which asks you to go beyond your roles and responsibilities, and that is where I guess the masculine self is kind of rising with women because of the roles and responsibilities that they are taking up. Many a times it's for their growth, and I think I'm in a similar place right now. But then I have been in touch with a lot of good people, and they have helped me get deep inside me and understand myself better and all of those things. The question that I have for you, Parul ma'am, is basically, would you recommend women in their late 20s, early 30s to come for a consultation to get any symptoms if they are noticing? Would it be better to come for a consultation and get those tests done and see if everything is going good, or is it something that we need to change in our lifestyle? Is it kind of a healthy approach that we recommend to really every person, every woman in the late 20s, early 30s, or is it just that if you are noticing some symptoms, you should come and get yourself sorted for the betterment? Like how do you would want women to take that up? Because I just shared a small symptom with you, right? But it may be something that you can guide me through once you do those tests, and it can kind of help me understand myself better, work on myself, change my lifestyle if required, or whatever, for a healthier living, right? So would you recommend people coming there and getting those consultations?
So anytime you are bothered by something, please go ahead and consult. And this is not for me particularly, but any gynecologist that you have been in touch with or who's approachable for you. I always say every doctor gets the patients they deserve, and every patient gets the doctor they deserve. So no one doctor is right for everybody. The same patient may be wonderful for one doctor and completely wrong for another one. So if it's bothering you, instead of living in denial, instead of self-diagnosing or struggling with ChatGPT and Google and whatnot, one conversation with an expert for 10 minutes can give you more solace and comfort as compared to 100 hours of Googling and ChatGPT and trying to self-diagnose, because there's so much attachment over there. We have so many blind spots in our own vision. So certainly, if it's bothering you, if there's anything and a good doctor will be able to tell you that, all's well. And a great doctor will be able to show you what is this telling you, and then you can titrate it accordingly. So, absolutely no harm in speaking to a doctor, no harm in consulting. And your awareness continues to guide. So, if you meet with a doctor and you feel aligned with them, by all means, follow up, by all means, complete whatever they're asking you, have an open conversation. I really appreciate when patients come and are able to exactly tell me, ma'am, this is what we read on ChatGPT. This is what I'm scared of. Could you explain this to me? I'm very happy explaining that to them. And if the doctor gets offended, or I mean, you'd know in the consult, you'd know whether this is the right doctor for you. So do go ahead and consult and do. I mean, the universe working in ways it works, you will find the right doctor for you. So absolutely no harm in consulting, and doctors will be hopefully very happy telling you if you're all good. And like you said, that it is guiding you about, sometimes life does demand that you take up more of masculine or more of feminine roles. Temporarily, it is absolutely fine. But if it's a pattern, so if I'm sick and my husband's caring for me, that is wonderful. But if I am sick and then I'm sick with a second disease and then I'm sick with a third disease, and in 20 years of marriage, he's been caring for me for 18 years, then something is radically wrong here. Something needs to change. So if it's a pattern where you find yourself repeatedly picking up the slack or repeatedly overstretching yourself, then it's a higher guidance that is showing up.
I have a question. You talked about chronic diseases like arthritis and high blood pressure. So I have BP. So what is the body trying to tell you? You said the body is trying to tell you something. So yeah, what is the body trying to tell me with
How
the high
wonderful.
BP? Yeah.
I love the directness of the question. So this is a book, and incidentally, it was here while this is a book. It's by Louise Hay. It says "Heal Your Body."
Okay.
It's coming. Louise Hay. It's a very thin book. It's barely, I think, a
Acha.
couple of pages. And all it
Okay.
has, has certain tables. And for every disease, it kind of spells out what is the disease trying to tell you. And then she also guides with affirmations on how you can change this.
Oh,
Regarding hypertension, so how
uh-huh.
about real time? Let me just open it up to hypertension, although I
Okay.
remember some of it. But this will guide us even better. So it's like a dictionary. You open it to hypertension. She says,
Okay.
see blood
It's called
problems,
Heal Your Body,
heal
right?
your body by Louise Hay. And so blood pressure. If you have high blood pressure, long-standing emotional problem not solved shows up as high
Okay.
blood pressure.
Okay.
And there are affirmations, that she says, I joyously release the past, I am at peace. Now, this needs to just be understood with a little bit of clarity. If I am not at peace and I sit affirming to I am at peace, I am at peace, this is going to further stress the already dysregulated nervous system because I am truly not at peace.
Absolutely.
So there has to be a certain degree of self-inquiry. There has to be a certain degree of courage. We are shit scared to look where it's hurting. I can have a wound over here that's bleeding, that's itching, that's hurting. And one of the most difficult things is to look honestly because somewhere within our essence knows what is wrong. Whether it's my relationship with my husband, whether it's the wrong profession I'm in, whether it's parental ill health, whether it is a sibling issue, whether it is a work issue. We know. It's just that we're so scared to face the truth. So hypertension, high blood pressure. See, the heart pumps blood and that creates pressure. So everybody's blood in all the bodies, the blood is flowing at a certain pressure. Now the heart is pumping against some resistance, which gives the blood its pressure. Here, the heart is having to pump against higher resistance, and therefore the heart is having to work extra hard, and the blood pressure rises. We can take medications and reduce the blood pressure, but that bypasses the message that the body is trying to give you. And typically, problems such as high blood pressure, diabetes, insulin resistance, obesity, cardiac problems, they come as a group. So you'll have one, or a body will show up one, and then very soon the body will show up the second one, and then very soon the body will show up a third one until we actually listen to it. So high blood pressure is your heart needing to pump against higher resistance. So perhaps exploring for yourself, where is it that you're experiencing resistance? Where can you soften? Where can you let go? Where can you release a little bit? Where can you relax? When you're calm, and you can notice, you can practice this, you can explore this. When you meditate, if you notice your blood pressure, it'll fall by 10 or 15 millimeters of mercury. When you don't meditate, when you're high strung, when you have meetings, when you're outwardly active, you'll notice them rising. uh, Explore for yourself. The body is such a beautiful thing. How is it when you are going to certain social situations? Does that energize you? Does that raise your blood pressure? How is
I'm
it when
not a social person at all. I do not like
so
socializing.
avoid, then
I
that is
don't.
who you
I
are.
avoid. Yeah, I avoid.
Wonderful. Wonderful. So living
But
even more in alignment with
Mhm.
what is the right, it's like when it's winter outside, we wear sweaters, and when it's summer, we switch to skimpier clothes. So it's as simple as that. Hypertension, continue your medication till it doesn't get sorted, but it'll get sorted once
Mm.
you're, and you can explore healing. There's a multiple panel of experts. In fact, I hear Dr. Pankaj and Dr. Mankul talk very highly about a
Okay.
session called Body Talk. So maybe
All
that
right.
would be wonderful for you to explore.
Okay.
Perhaps Dr. Mankul could recommend a good practitioner at the clinic who could take the session for you. And if it aligns with you, please go ahead and pursue it. Uh,
Sure.
Allow the body to talk. It screams. It screams so loudly.
No, so I was just wondering, like you said, if the affirmations will not help me unless it's coming from inside. So, like, what
Don't.
do I do? Because I've tried and tried and tried a lot of things. It's been like 3 or 4 years. I've tried diet, I exercise, I do everything possible, but nothing else.
So I really strongly feel, Abhilasha, for you, the body talk session might be very helpful.
Okay.
It is done by a practitioner who is very well trained, a practitioner who is very intuitive,
Mm.
and that will help you see where you're unable to see. So if I have a
Uh-huh.
lesion on my back, somebody holding a rearview mirror, somebody just showing me the
Yeah.
mirror helps.
Yeah. Yeah. Yeah.
So perhaps you could get in touch with the staff at the clinic and they could help you
Oh,
with it.
thank you.
Thank you.
Vilasha, I mean, the way we look at it is that there is something we need to expand our awareness towards, something that is there. And there are also physical aspects that you mentioned. There is diet and other things. Acupuncture is very helpful with blood pressure. There is Dr. Shruti. I think she's there in the session as well.
I go to her.
Ah, okay, great. So maybe you can explore expanding the awareness, and whether it's me, Dr. Pankaj, or Sadhna Mehtaji,
Okay.
all three of us practice a modality called body talk,
Uh-huh.
where it gets a little more specific and precise to what may be relevant to you
Okay.
in the situation, and that might help.
So how can I have a
That
session?
you can, you'll find the clinic details.
Okay.
You can just write a message on the. Are you part of the clinic group
No, I
or
don't.
in a healing
They
collective group?
recommended,
Okay,
sent me the link.
I
That's
I
why I'm here.
I'll
sure.
guide her,
So
uncle. I'll guide her.
yeah, sure. Dr. Parul, I had a question which is related to Manmeet's question. Because as a dermatologist, we also see a lot of hormones and hormonal issues in women, which is high prolactin. And at least my understanding of high prolactin is from a medical perspective, its prolactin goes up when women are breastfeeding and then they don't get periods. And what we see is women, let's say a teenager or a girl in 20s going through an exam, they would skip periods and we would invariably pick up a high prolactin. So, how do you see prolactin in this whole psycho emotional and physical aspect?
So it's amazing you asked about prolactin. One of the experiences that I had with prolactin and the understanding of prolactin was this woman showed up to me, was trying to conceive, and had started to have irregular periods, and high prolactin was noted. And instantly, when she was sitting in front of me, I'd known her for about 2 years, and I had joined back work after a sabbatical. This was one of the first patients I had seen after I joined back work after a sabbatical. And it instantly grokked. Her first child was born preterm, was born through a very difficult and traumatic delivery, and was kept in the nursery for about 2 months. And therefore, she could not breastfeed at all. Not a drop of milk came. She couldn't breastfeed, could not bond with the child. And the child was diagnosed with severe autism at the age of 1 year or so. And now this son of hers was 5 years old. And as soon as she started to think about having a second child, when she'd seen me earlier, she had seen me about 2 years or 3 years after her delivery for some repeated vaginal infections that she was having. And the trauma of not being able to breastfeed her son was very, very active in her then. And now, when she was trying to conceive a second time, her primary question was, will I be able to breastfeed this child? And that was a very strong subconscious intention that she was holding on to, so much so that even before conception, the prolactin had gotten released and the breast had started releasing milk. And when I asked her pointedly, she said, this drop of milk, which is coming now, even when I'm not pregnant, was not there even after delivery. So she said, not a drop of milk came out because the stress was so high about the delivery happening preterm, about it happening in a small nursing home, about it, the baby being being kept in nursery and requiring a lot of support. And I said to her, the breastfeeding happens after the delivery. The delivery happens after the pregnancy, and the pregnancy happens after the conception. So all you need to do is release, go at it stepwise, allow yourself to conceive, and trust that if you conceive, the pregnancy will move forward, and trust that if the pregnancy is moving forward, delivery will happen this way or that way. You will deliver the baby. And once the delivery of the baby happens, milk will flow. Like that is It's a principle on which the whole dairy industry is predicated. Like, you've delivered a baby, a mammal has delivered a baby, milk will flow. And I go crazy talking about breastfeeding. People have such questions these आजकल दूध आता नहीं है, आजकल प्रॉब्लम बहुत हो रही है ब्रेस्ट फीडिंग में, जहां होना चाहिए वहां ब्रेस्ट फीडिंग हो नहीं पा रहा है, जहां नहीं होना चाहिए वहां पे प्रोलैक्टिन बढ़ रहा है, मिल्क रिलीज हो रहा है. Prolactin rises when there is the urge to nourish a young one in a mammal, in a female mammal's body. It is so clear, and somehow it will align with the story of that particular patient that you're seeing. For me, this became very clear for this patient, and while I wrote Capgolin for her, which is a medication to reduce prolactin, I also told her, unless you let go of the, she was very stressed about the breastfeeding, and I said, wait, conceive, and then go ahead. Within 2 months, the prolactin came down. Of course, Capgolin is a fantastic drug, reduces prolactin quite immediately, but it never rose up again. She conceived within 6 months. She had an uneventful pregnancy. She had a delivery. And post delivery, she took one lactation counseling session and she breastfed exclusively for 6 months. It was so beautiful to see this. And she could see her body giving her those signals. So I think understanding what is really happening in the body, prolactin is the urge to nourish a young one. So, and sometimes this can be seen in young girls. I've had an experience with a 10-year-old girl whose mother had died at the time of COVID, and she had a younger brother, 6 years old. And when she came to me at 10 years, her periods had begun a couple of months before, but then stopped. And very often we see irregular menstruation during the first 2 years of a girl's life, and that is perfectly natural. But the father was very concerned, and so on his insistence, I ordered the blood test, and the prolactin showed up as high. And my guidance was towards the father to help. The child has lost a parent and is now getting parentified to fill in the role of the mother for the younger brother. And therefore, the body is releasing prolactin and there's hyperprolactinemia. It is not the child's job. The child herself is grieving and has had a loss of a parent. So, my guidance to the father was, as much as you can, relieve this child. If you can communicate to the child, it's the father's job to now look after both the children. The mother's absence is not to be compensated for by the elder daughter. If that happens, there are multiple enmeshments that will happen within this family, both for the father and for the child and for the younger brother. uh, Things happen in life, and the way we compensate becomes the bane that we carry. It becomes the baggage that we carry. And 20 years later, 30 years later, there will be cancers, there will be heart attacks, there will be arthritis, there will be divorce, there will be multiple relationships, there will be bankruptcy. Everything that we see in people in their 30s and 40s, all forms of midlife crisis, by the way, are showing us the faulty entanglements and enmeshments that had happened. Many of them are rooted in our childhood. Yes, some could be rooted in past life experiences. Yes, some could be rooted in inherent vasanas and vrittis, certainly, but those are more difficult to see. Examining the childhood, and you instantly know. And my guidance to the father, and incidentally, in the last couple of months, I have had 2 or more fathers reach out to me whose wives passed away. And one I delivered 7 years back, another I delivered 5 years back. And they're reaching out to me just to let me know that the wife passed away, and just to seek out guidance. And the only guidance that I give them is, very often children lose one parent to death and the other one to grief. So be very mindful. I do not subscribe to the fact that grief is forever. I do not subscribe to the fact that trauma is very deep and cannot be healed. My deepest and most uh, my truest and deepest belief is in healing. Health is natural, wholeness is natural, disease is what we place on top of it. And as much as it may be hurtful to consider कि मैंने क्या किया, एक तो मैं बीमार हो गई और आप मुझे ही कह रहे हैं कि मैंने कुछ किया है. That is the only pathway to healing. You cannot heal without looking within. So prolactin is caregiving, it is nurturing. So wherever there is that imbalance, perhaps correcting that for the child, and because you specifically asked about children, children can be very powerless to correct it, even though intuitively they're much more evolved than us. But uh, I mean, what does she do? She has a younger brother, and she sees her father crying, and of course the father is allowed to cry, and of course the younger brother needs nurturance. But can it be solved? So my definition of a healthy family is when nobody is minimizing themselves for the greater good. A healthy family is one where everybody can present their authentic, full forms and be together. Uh, So maybe assessing that angle would help.
That's beautiful, Dr. Parul. The pearl is the urge to nourish, and it rung a bell because we see even the prolactin of fathers going up when a child is born. So there are studies on that. So how it is related to, probably it's an urge to nourish or somebody seeking to be nourished, probably in exhaustion or acute stress.
So
Probably it's the word is nourishment.
a response to the urge to nourish. So if I'm
Response to
seeking
the urge
nourishment,
of
I
nourish.
cannot breastfeed on my own breast milk. It's like if I'm
Yeah.
hungry, I can't bite my own finger and eat it. So the urge to nourish, but if it's rising in men or if, even if in women, in girls, in young girls or women, if it's rising, it is a response to a strong urge to nourish in somebody
Uh,
close by in the circle.
so this
मेरे में
word
अर्ज टू नरिश होगा
rings a
तो मेरा
bell
ब्रेस्ट मिल्क नहीं
actually.
निकलेगा मैं किसी के अर्ज टू नरिश को रिस्पॉन्ड कर रही हूँ तब ब्रेस्ट मिल्क निकलेगा and it happens in men so beautifully. You expanded on this. Thank you. It totally does.
Beautiful,
Totally does.
beautiful. Anybody else? A question? Ruchi?
Yeah. Thank you, Dr. Parul. What a beautiful session, and the kind of emotional patterns that you have linked, which are unfortunately not talked about by most of the gynecologists because it goes in a very systematic way, and nobody looks at health in such an integrated way. Being a yoga instructor, what I have witnessed in the past couple of years, a trend in the women, especially in the, say early 40s or late 30s, is it's a similar trend that I've seen that women being too much at work, worked out mentally, having low HB levels, and going through very heavy menstrual cycles, or going into a stage of early a perimenopausal stage, but mentally very taxed out. And so can you draw a relation between these things, that heavy bleeding, low HB levels, these things I understand go together, but at the same time mentally they are very stressed out, and so their anxiety levels are very high. So if you can please throw some light on this.
Thank you, Ruchi. I do not know how, but every question is like, it's just popping so many things within me. So, lovely question. And like you said, now just this statement that heavy bleeding goes hand in hand with a low hemoglobin. Yes, it does. But we've normalized it so much. See, the body is so intelligent. Like, the body is supremely intelligent. The body has the greatest, it is a manifestation of divine intelligence beyond whatever we can study and manipulate. We're all doing these petty little tricks and clever little tricks. The body's intelligence is infinite. A woman's body is supposed to bleed every month, but there are mechanisms already in place so that the blood loss does not exceed a certain volume. The blood loss is just enough to clean the uterus and prepare it for the next cycle. The blood loss is not, she's not supposed to bleed to death. She's not supposed to bleed to the point of low hemoglobin. See, in the modern society, we have iron supplements, we have tests, but women have lived for lakhs of years in jungles, in tribes. So many of them still are. So कहाँ पे iron supplementation, कहाँ पे fixed wake up time, fixed sleep time, multiple, no contraception, multiple pregnancies. So it's good to use modern medicine, but I think it would serve us all very well if we did not use it as a crutch. बड़ी से बड़ी बीमारी में ये सोचा जा सकता है कि ये सारा तामझाम ऑफ मेडिसिन एंड डॉक्टर्स एंड हॉस्पिटल्स एंड मेडिसिन सब कुछ इसके बियॉन्ड भी लोग जिंदा रहते थे. So hang on and let me just see what's really happening. So heavy bleeding very often is uterus. The way I see it is, the tears you don't shed, the uterus sheds for you. So when women don't shed their tears, वो बिल्कुल बाहर से बहुत सब ठीक चल रहा है, सब बहुत अच्छा है वाला. Heavy bleeding leading to low hemoglobin. So very often when I see a woman with anemia and a woman with menorrhagia, one of my first questions to ask them is, कौन तुम्हारा खून पी रहा है? 80% of the times I receive a pointed response. One word answer. Pati, saas, boss, bacha. Literally 80% of the time, this is the question and this is the answer, and the consultation can actually end there. Vasool ho gaya consultation for both the doctor and the patient. But of course, we go on. So the low hemoglobin is any bleeding which is manifesting in a low hemoglobin is too much bleeding, whether she may call it too much or not. So heavy bleeding leading to a low hemoglobin. very often is seen in women who are overworked, who are stressed out, who are exhausted, who cannot stop working. Now, the question is, when every time I use the word can, I often assess for myself, I can or I won't. I can or I will. I cannot or I won't. So if and sometimes what is true for me is, let's say I'm a woman who can't stop working. I'm working 14 hours a day. Of course, if I'm working 14 hours a day, I'm probably very good at my work. I probably receive a lot of praise, a lot of adulation for my work. I'm the rock star at my work. But am I working so hard because what I'm trying to escape is a difficult family relationship at home, maybe with the mother-in-law, maybe with the husband, maybe with children? Am I working so hard because I was brought up believing that unless you contribute a certain income to the family, you don't mean a thing? Your only worth is what you bring to the financial health of the family? Am I working too hard because love in childhood was conditional? It was predicated upon good marks. It was predicated upon desirable behavior by children, by my desirable behavior towards my parents. If that is so, and if my belief is unless I work 14 hours a day, unless I am the VP or I am a great lawyer or a great doctor or whatever, then I am compulsively working so hard. I'm not working so hard because I need the money. I'm not working so hard because मुझे कल का खाना नहीं मिलेगा अगर आज मैं काम करके नहीं आऊंगी. इनफैक्ट एक मजदूर बहुत आराम से काम करता है, 3 दिन काम करता है, दिहाड़ी मिल जाती है, उसके बाद 2 दिन छुट्टी मार लेता है. अब ये पैसे खर्च करेंगे फिर वापस आता है. So very often, I once from my clinic I went down and this was a golgappe wala and I wanted to have nikalते हुए because why did I wanted to have golgappe? It was not a celebration, it was not a treat. I had to rush to a delivery and I did not have time to go home have lunch. So my lunch was quick, 4 golgappe खा के मुंह में भर के भागेंगे. And the Golgappa wala looks at me and says, Abhi khula nahi hai, madam. And I was stunned. He would be earning a small fraction of what I make in a month. I did not have the power then to tell a patient, time khatam ho gaya ji, clinic band ho gaya ji, aap late ho gaye, main nahi ruk sakti, I did not have the power to refuse a patient despite probably earning 100 times of what that Golgappa wala earns. So it was not money that was driving me. What was driving me was an inability to say no. Women often have an inability to say no when their self-worth, when their whole survival is predicated on the value of their work. So we really need to, and एक honest conversation में, हाव भाव में, body language में तुरंत आ जाता है. आप mention करो. I'm very often, when I just mention, in fact, I happened to say to one of the women that I saw recently who was planning a second child, the reason for planning the second child was, मैं और मेरे husband तो दोनों working है, तो जो ये 3 साल की बेटी है जो आपने ही पैदा कराई थी 3 साल पहले, वो खाली होती है घर पे, तो उसकी कंपनी के लिए चाहिए. And I said, wow, so the newborn baby will look after the elder sister. So the newborn baby is the caretaker, is the parent. नहीं नहीं मैम, पर हम दोनों के पास तो टाइम ही नहीं है. आपके पास अगर एक बच्चे के लिए टाइम नहीं है तो दूसरा बच्चा आप क्यों पैदा कर रहे हो? It's so and there was that consultation, I remember, I said, what? She said, I can't leave my job. Obviously, I can't stay home. And I said, you can't stay home not because what you bring to your job is so unique कि पूरी दुनिया में कोई और नहीं कर सकता जो तान्या कर रही है. You can't leave your job because staying at home kills you. You feel you'll die. You feel suffocated. It is difficult. It is difficult to the point of almost impossibility for you to stay home and just be okay with it. And it's not her alone. It's not talking about that one woman. I'm talking about each one of us. I had that inability in myself. And it was after a sabbatical, after a certain sense dawned, grace, illumined life, I decided I will not go to the clinic in the evenings, whereas evenings is prime. Today is a Sunday. But otherwise, evenings is time, when your clinics are the busiest and you're happy being the rock star on stage. And when I decided I'm not going to go to the clinic in the evening, I remember sitting and there was a moment, there was a call by a patient and I answered it and they said, can we come and see you? And I said, no, I don't sit in the evenings now. And the patient was very sweet and very, he said, oh, it would be so nice to see you, but I can't see you in the morning. The only way I could see you was if you were to sit in the evening. And a part of me wanted to go and just rescue and hug this patient and, solve it for her and be the rock star that I had been so long in my life. But I just held on. I held on and I told myself, Parul, hold. Ye kahan se aa raha hai? Where is this compulsion coming about opening the clinic? And the thoughts that the mind said were, khali to बैठी हूँ. The husband is in another room. The daughter is in another room. क्या कर रही हूँ यहाँ बैठे? Clinic 5 minute दूर तो है. Why can't I just go and see this patient and solve it for her? How easy it would be. But because I could see that it was coming from a place of compulsion and unease about sitting at home alone, not really being in demand by either the husband or the daughter, I kept sitting and watching and watching. 20 minutes, all of that fear and fear of missing out, all of that हो ही क्या रहा है, जाके देख तो सकती ही थी, why are you not being productive, are you being lazy? All of that rose and it all fell. The monkey mind had its play. Sab kar liya, and I kept sitting. And then I noticed what happens when you feel any feeling to its fullest. The only thing that remains after the feeling has been fully felt, it has risen, it has fallen, multiple sub feelings have risen and have fallen. The last thing that remains is peace. Every feeling leads to peace. It's like एक सफेद चादर, सारे उसके ऊपर के जो भी मैल लगी हुई है, जो भी रंग लगे हुए हटा दीजिए, सफेदी अंदर से अपने आप. You don't have to whiten the चादर, it is already white. Peace is already there. हमने non peace ऊपर से ओढ़ा हुआ है. I kept sitting there, and then I noticed there was a flushing of peace, and I was at peace sitting right here on this sofa when this episode happened. 10 minutes later, into peace, my daughter came, sat on top of me, and children are very smart. They assess, they look for permission from your non-verbal language before they speak and before they share their truth. And then my daughter said, she shared something about, Mama, 1 month, 2 months back, she spoke about something, some difficult experience that she had in school. And she was able to share that because she sensed the peace that was already suffusing this body. She drunk on it, she nourished on it, and then she gave me a case and then she ran away. And my whole body was electric at that time. And I was like, oh my God, I nearly missed this. मैं 10 मिनट पहले क्लिनिक के लिए रेडी होके निकल गई होती, ये बच्चा ये बात नहीं करता. इनफैक्ट रेडी होती, as soon as I wear my sari, my child looks at me differently, speaks to me differently. When she was very little, she would resist it. I would wear the sari and she would make stupid excuses. She would say, I need to go to the washroom, aap khana khila do, mera toy pakad lo. And there would be that pull. But now that she's grown up, she just holds things and keeps them to herself. थोड़ा सा हम खाली स्पेस क्रिएट करेंगे, थिंग्स विल शो अप. हम खाली स्पेस नहीं क्रिएट करते हैं. We are so scared of khali space. We are so scared of 10 minutes of silence. We are so scared of ourselves. Really, all that is needed is to be with yourself and allow whatever's coming. Just allow the tears. So stay clear of the story. Allow the feeling and the perception in the body. Sometimes what people understand is story बार बार सुनाओ, फिर ऐसा हुआ, फिर वैसा हुआ, ये trauma है, ये ऐसे हो रहा है. Not the story. The story is the mind pulling you away from wholeness, giving you the story always starts with a wrong assumption. The story always starts with I, and lest I go into a whole long this thing, the I does not exist. So don't engage the story, but engage the body. How are you feeling? What is happening? As soon as this call came, I had this pull in my chest to go towards her. There was a feeling of unrest. कि मुझे जाना है, मुझे patient को देखना है, मुझे ठीक करना है. Just hold on, just watch it. Patient ठीक हो जाएगी. किसी भी डॉक्टर को दिखा के हो जाएगी. ऐसा तुमने क्या स्पेशल पढ़ लिया जो किसी ने नहीं पढ़ा? I keep telling patients, all doctors have read the same books. All have passed the same exams. All are using the same pharmacies and the same brand names and the same drugs. So really, your connection with your doctor is not the difference between her degrees, and she may have many flashy degrees. But the connection with the doctor is energetic. So it is with the daughter as well.
Thank you so much. So beautifully put up. I'm going to take up your details from Dr. Mankul because it's going to be very helpful for so many women whom I know. And thank you for the lovely talk.
Thank you. I think we could have another session because for us, when we talk to Dr. Parul, it's like a lot of feels, a lot of different belief systems being shattered because she shows you the mirror. So thank you, Dr. Parul, as always, for doing that. And I think if you have any other questions, maybe you can post it in the group, and I'm sure Dr. Parul will be happy to give a complete answer to your query. And so thank you so much to everyone. And we meet again next month on the first Tuesday, 8:30 p.m. We are hoping to start for everyone in the evening or in the morning a time for journaling or some art work. Half an hour slot where different people we can hold space and all of us can journal and do art almost on a daily basis. Because we've had a resounding response for everyone. Everybody's loving this. So look forward to beginning that as well, apart from our once a month journey. Thank you so much to all of you for joining. Thank you.